turn next to hear from Becky Wampler, Director of Healthcare Sustainability at Wellmark Blue Cross and Blue Shield. Wellmark is really leading the way in their states in community health improvement initiatives, and we're so pleased to have Becky with us today to share a little bit more about their work in Iowa and South Dakota. Becky?
Thank you, Catherine. And I'm stunned at all the great information that we're hearing, and some of mine might be a repeat of some of what Dr. Thorpe shared, so just kind of bear with me if you will. I want to give you a little bit of a background of who Wellmark Blue Cross Blue Shield is. We're the Blue Cross and Blue Shield plans in Iowa and South Dakota. And it's important for you to know that we're a mutual insurance company and we're owned by our customers. So this business model is really the basis for the decisions that we make here at Wellmark, and that may help you understand why we're doing what we're doing. So let's go to my next slide. There we go. I'm providing this to you because we're very proud of the fact that our administrative costs are extremely low. Just under 11 cents is used of every premium dollar that we take in to pay for administrative costs. Almost 86 cents of every dollar goes out to pay for healthcare services. And even though we're quite lean from an administrative cost perspective, our board said it's not enough to be administratively lean. We have to figure out how to pay out less dollars overall, or to decrease the overall trend and what's happening with spend. So we looked for efficiencies internal to Wellmark. We looked for efficiencies internal to the whole healthcare system, but we quickly realized that we needed to improve the overall health and well-being of Iowans and South Dakotans in order to reduce healthcare spend. And by now you've probably all heard that your zip code could impact your health more than your genetic code. And we have built a community-based approach to assist citizens in making small changes in their community to improve overall well-being. And to help kind of understand this in a succinct and easy way, we have a short video that explains our Healthy Hometown Initiative. So I'm going to play that now and then pick back up here in just a second.
Getting and staying healthy. It can be a challenge, can't it? Between work, school, and other commitments, some days there just aren't enough hours. But have you ever noticed how your surroundings affect your activity level? Just think about your normal day. Is processed food easier to fit into your hectic schedule than a healthy meal? Do you drive to the store rather than walk? How often are you on your phone or tablet? Our day-to-day activities and where we live impact our health. In fact, your zip code may impact your health more than your genetic code. Americans are experiencing more chronic health issues and are more overweight than ever before. 30 years ago, obese adults made up less than 15% of the population. Today, 2 out of 3 adults are overweight or obese. So why do our waistbands continue to get bigger? Well, we consume what's convenient. Items like soda and potato chips are in every convenience store, vending machine, and checkout lane, and fruits and veggies are scarce. More than 75% of kids don't eat green vegetables daily. Americans consume 600 more calories per day than they did in 1970. That's equivalent to an extra lunch. We also eat 30% more added sugar, which is in part due to increased portion sizes. And since 1960, our plate sizes have gotten 36% bigger. In addition to our changing eating habits, we move less. Transportation systems are designed for cars instead of people, resulting in communities' reduced walkability. U.S. adults walk less than 5,000 steps a day, and the number of kids who walk to school declined from 48% in 1969 to 16% in 2011. Even the social connections we make are often virtual rather than face-to-face. Adults spend more than 10 hours a day on screen time, and kids spend more than 6 hours a day, which also leads to decreased physical activity. But there's a solution to these problems, and they start in our hometowns. A community can't change habits, but it can be a guide to better ones. Small changes like creating biking and walking paths and establishing community gardens are just a couple ways to reduce these issues, and Wellmark Blue Cross Blue Shield wants to help. When citizens band together to make healthier choices easier, the results are enormous. Learn how you can help make the future healthier by visiting wellmark.com/healthyhometown. There you can take a self-assessment or get expert consultation on ways to enhance the well-being of your community, all at no cost. What are you waiting for? Visit wellmark.com/healthyhometown.
So I'm going to give you a little bit of background as to why we're going down this path. This slide shows obesity trends in the past 30 years, and Dr. Thorpe spent a little bit of time on this as well. But in Iowa and in South Dakota in the last 30 years, our obesity rate has doubled. It's gone from 15% to 30%. And in fact, we have 2/3 of Iowans and South Dakotans who are either overweight or obese. And this is really of great concern because we know that obesity is a driver of more than 30 chronic conditions, and some experts even say maybe even up to 50. So we took a look at our claims data, and we know that that obesity is a significant driver of costs. Individuals with 1 to 3 chronic conditions account for 58% of the claim dollars that we pay out. And I heard Dr. Thorpe talk about 86% when you consider all chronic conditions. If this goes unabated, it's estimated that by 2030, in our 2 states of Iowa and South Dakota, 1 in 8 of us will be diabetic, 1 in 4 will have hypertension, and 1 in 4 will have heart disease. And when you think about the cost, you can't just add these costs up and say if I have all 3, it's going to be $65,000. You really have to double or triple it because it exponentiates the more conditions that you have. So the cost is significant. And Dr. Thorpe also talked about the fact that we have the ability to impact a large percentage of those factors that influence our overall health. So while I've painted a bleak picture, there really is some hope. And that's why we created Healthy Hometown. It's designed to help community leaders implement evidence-based tactics that nudge individuals into making healthy choices. And again, I want to say evidence-based tactics that are in the public domain. We've made these resources available to any community in Iowa and South Dakota at no charge. And I know in the video it talked about how you could take a self-assessment or get expert consultation. That expert consultation is in the field. We come to your community and we work with communities who want to engage in this work. And we've organized Healthy Hometown into 3 work streams: eat well, move more, and feel better. That's really easy for communities to understand. And let's look at a few examples of what those things might be. Say a community wanted to work on eating better, that they wanted to work on nutrition in their community. One tactic might be to implement policies to have healthier items available in vending machines, whether it's at work sites or whether it's at ball fields or whatever. You could have a vending machine that looks like this, where it's hard to make a healthy choice, or you could have a vending machine that looks something more like this, where there are several healthy choices available to you. Perhaps the community would like to work on moving more and getting more physical activity and wanting to know what they can do to make their town more appealing for active transportation, walking, biking, etc. Well, let's look at an example. This picture could be any small town in Iowa, South Dakota, or really the nation. And you look at this picture, and it's really not that appealing. It's not appealing to engage in active transportation. I don't even know if it would be safe because it's hard for me to tell where I can cross the street. It's hard for me to know where I should be riding my bike. It's even somewhat difficult for cars to know where to drive. But if this community had a complete streets policy and applied that to that same location, it could look something like this, where it could invite activity and active transportation. So the road width here has not changed, but we've added a bike lane, we've put in a center turn lane, we've demarked the pedestrian crosswalks, And we've also put in bump outs so there's less traffic for the individual to walk across. And that just makes it more inviting and safe to engage in active transportation. And then from a feel better perspective, volunteerism, we all know that volunteerism helps people with their own physical and mental and emotional well-being and having improved social connectedness. The other things that we put in the feel better category are things like tobacco policies, whether or not there are tobacco-free parks, tobacco-free apartment buildings, and things of that nature. We have identified more than 100 evidence-based interventions from entities in the public domain, from places such as the CDC, Robert Woods Johnson Foundation, the Urban Land Institute, and others. Those are just some examples. And we have categorized those into the 3 categories I just went through, but then also where a community could do this work. They could do it at a community level, in their healthcare systems, in their schools, at work sites, etc. So there's a lot of opportunity for a community in whatever they wanted to participate in. And we have found that the community leaders that are really forward-thinking, they realize that a healthy hometown is really good and vital to their local economy because it makes sure that they have a strong workforce and it just makes their community more attractive to industry who are looking to relocate. So we've gotten a lot of buy-in from business leaders who want to do the work for their communities. I'm going to share with you now just 3 slides. I'm going to go through them quickly because they will actually be posted later after the webinar of what some communities have done. So Cedar Rapids is one of the larger cities in Iowa. They've done a lot of work around community gardens and donating produce. They have put in free shuttles that allow people to get to healthy food options and to farmers markets, and they have a complete streets policy, and they've done a lot of conversions on their one-way streets, turning them to 2-way and putting in bike lanes. Another town is Mason City, which is a mid-sized town in Iowa. They too have done a lot around community gardens and donating of produce. They've also done a lot with bike lanes and activity from that perspective, and placemaking, so a lot of sculptures, encouraging people to be active in their transportation options. And then finally, Sioux City, another mid-sized town, they did a lot with walking school buses, so getting children to walk to school. They have a community garden at their daycare, and they've done a lot of trail expansions. So again, these are just some examples of what communities can really do. And in most cases, there is not a lot of cost to these solutions. And then finally, just a slide to show you our breadth. We are actually, this slide says that we're in 32 communities. I need to update this. We're actually working in about 40 communities now across Iowa and South Dakota. And this is a solution or an approach that a community can choose what works for them. They can choose, like I said, to either eat well, move more, feel better, and bite off what they can chew and get little successes under their belt and then get kind of the steam built up to take on the next project. So that's what the Healthy Hometown Project is all about, and I'll be happy to take questions after the last presenter. Thanks, Catherine.